The research experiment I chose to focus on was an experiment looking into the factors contributing to lameness and range of hip motion, specifically in Labrador retrievers. Since hip dysplasia is common amongst Labradors, it makes sense to base the experiment on this breed of dog. To start off with the materials and subjects used, the experiment consisted of 60 Labradors that were referred to the North Carolina State Veterinary Teaching Hospital between 2001 and 2011 and had evidence of osteoarthritis in one or both hip joints. Each dog was given the same physical. A total of 112 limbs were candidates for the experiment. All dogs were tested for pain with hip joint movement, and dogs were sedated and hip measurements were taken with a 15 centimeter plastic goniometer to measure the dog's hip angles. Ventral dorsal radiographs were also taken of the dog's hips, or previous ones were used. Subluxation was defined as the presence of an increased joint space between the acetabulum and the femoral head. Luxation was termed as the absence of an overlap between the acetabulum and the femoral head. The flexion and extension angles were also recorded. The median was taken of the three major measurements and used in the experiment's data. Each Labrador owner was given a questionnaire to get more information about the dog's daily habits, including sleeping habits, medication, and if the dog was an indoor or outdoor dog. The questionnaire also included duration and intensity of exercise, either high or low, as well as the type of exercise. The age of the dog is a factor into the experiment because the younger or older the dog is, the more severe the osteoarthritis can be. Each Labrador was given a gait evaluation to show how far their osteoarthritis had progressed before starting the experiment. A body condition score on a scale of 1 to 9 was given to each dog, 1 being extremely underweight, 9 being obese. Sleeping habits were recorded, such as does the dog sleep on a hard floor or a bed, as well as any medications the dog was currently taking. The softness of the dog beds, going down to the thickness and the type of bedding, such as cotton or feather, was also taken into consideration. The severity of lameness, ranging from none to severe, were given to each dog, as well as the duration of the lameness that had been occurring. And here is a picture of the goniometer used to measure the hip angles and the range of motion. The plastic goniometer moves and it rotates to fit the leg, and the angle shown on the round part is recorded. The data was classified and grouped into duration of exercise and impact of exercise. Limb lameness was evaluated and rated on a 1 to 4 scale, 1 being none, 4 being severe. To put all dogs into perspective and to be able to compare them to one another, regression models were made and medians were taken from each regression line. The regression lines were used to determine whether age, BCS, exercise duration or type, intensity, and severity of lameness, just to name the major ones I've touched on, were associated with the lameness score. Another analysis was performed to determine the factors that were associated with the size of osteocytes. The graph shown here was one comparing the body weight to hip joint extension for the 112 limbs that were being studied. The other graph is comparing the age to hip joint extension for the 112 limbs that were being studied. They were used to compare the hip joint extension to the lameness score. The results of the 60 Labradors and 112 joints of interest: there were no lameness in 52 limbs, mild lameness in 63, moderate in 1, and severe in 6 limbs. The median duration of lameness was 2 months. Of the 60 dogs, 19 did not receive medications, 22 were treated with an NSAID to help their osteoarthritis pain, 2 were treated with prednisone, and 1 with an injection for pain management. The results concluded that age and body weight correlated with the hip joint extension. The type of exercise was not associated with lameness, although the exercise duration was associated with hip joint luxation. Exercise in dogs with dysplastic hips was actually proved to help hip range of motion. Lower lameness scores were associated with dogs with lower exercise duration. In more present studies, hip joint extension was shown to be decreased in older dogs and heavier dogs, although this is thought to have little clinical importance. Large loss of hip joint extension could be an early indicator for osteoarthritis in dogs. There are still a lot of questions on the known factors that cause hip joint extension and osteoarthritis in dogs, whether it has to do with age, weight, exercise factors. Lameness scales are also hard to give from person to person and universally because everyone has a different opinion. So not everyone will get the same score on a dog unless the dog is severely lame. So in conclusion, the type of exercise was not a factor that contributed to lameness in Labradors with hip dysplasia. The duration seemed to have some effect, giving the dogs a lower lameness score that exercised for less time. With more breeds being looked at in the experiments looking into osteoarthritis growing, we may find out that there are specific factors contributing to the lameness that goes along with osteoarthritis.